All right, so today I'm going to be presenting on herbalism and inflammation. Inflammation is something that's very important to me as it's something that I struggle with daily. I don't have a diagnosable problem yet, but it could be autoimmune or something related to that. So today I'll be going over some of the plants that can be used to treat inflammation. I tried to say the things that I knew that college students would easily find because it seems like sometimes that medicinal herbs used to treat things or to remedy things are sometimes a little out there and difficult for the average person to have. So the first thing that we need to cover is what exactly is inflammation. It's characterized by pain, heat, swelling, and redness, and it is caused by inflammatory pathways that result from either pathogens or an overactive immune response. What happens with that is once the pathogen enters the body, either through a cut or some other opening, it causes the blood pressure to increase in the blood capillaries, which leads to the release of fluid within the interstitial cellular membranes. And after that, the excess fluid cannot be picked up by the lymphatic capillaries, causing what's known as swelling. The increased blood pressure is what causes the heat and redness to occur, and then finally the pain comes from tissue damage that's occurring due to the swelling. Inflammation can be acute or chronic. Acute can last from a couple days to maybe a couple weeks and is usually due to a pathogen or injury, where chronic can last from weeks to even years. In the case of chronic, it's usually caused by an overactive immune response or pathogen that's just too hard for the body to break down. Some of the problems that arise from inflammation include cardiovascular stress, headaches or migraines, digestive problems like inflammatory bowel disease or Crohn's disease, respiratory stress, neurological issues, and obviously arthritis. All of these are caused due to either inflammation of the vascular system or dilation of the vascular system. Especially in the case of digestive bowel problems, it's due to an inflammatory bowel reaction or an inflammatory colon reaction, which makes it very difficult to continue to eat or digest food. Most of these conditions are going to be treated with NSAIDs or non-steroidal anti-inflammatory drugs. The problems with these is that they have a lot of side effects, and because they're over the counter, many people overdose on them or take too much. And that leads to a lot of issues, especially interfering with the mucosal health in the gut. When the mucosal health is interrupted, that allows bacteria to easily stick to the inner membrane of the gut, and also prevents food or other digestive material from sliding through the digestive tract in a healthy way. NSAIDs can also affect kidney function and cause dehydration, and in one study it showed that it delayed muscle regeneration. So it's important that we find an alternative to NSAIDs that work just as well, if not better. So the first idea that I have to combat inflammation is by following an anti-inflammatory diet. Typically, a Mediterranean diet is what this is called because people who live in the Mediterranean have almost no counts of inflammation. This diet mostly consists of fresh produce, especially tomatoes and leafy greens, and fruits that are high in antioxidants, such as blueberries and oranges. It can also include nuts and high fiber foods, and fatty fish like salmon, mackerel, and tuna. While this anti-inflammatory diet is wonderful in reducing inflammation, it's not so great in treating inflammation. So we're going to look forward for some other options for that. One of the most popular ones that's been used for thousands of years, dating back to Mesopotamia and Hippocrates, is white willow bark. It is a precursor to modern aspirin. It starts with the main therapeutic active ingredient in white willow bark, which is salicin. Once that becomes oxygenated, it becomes salicylic acid. And because salicylic acid is actually an irritant to the gut, they acetylated it to become acetylsalicylic acid, which is the main active ingredient in aspirin. And white willow bark has shown to have anti-inflammatory effects that are identical to NSAIDs with fewer side effects. What you might recommend salicylic acid, or what you might notice salicylic acid is in acne medication. It is the main active ingredient in acne medication, and when used topically, it is shown to reduce the inflammation, especially of um, inflamed facial pores. In one study, it was shown that 95% of people who use salicylic acid cream for two times a day for up to 4 weeks experienced 95% improval rates, with 50% of those having complete cleared or significantly improved acne. So next on our list is feverfew, which was usually used orally to treat headaches and vascular inflammation that causes migraines. However, it was used in ancient China to clear heat, which one can deduce is meant to clear the redness and swelling from an inflamed joint. So it does have anti-inflammatory effects. However, the main sesquiterpene in it is parthenolide, and parthenolide has been known to cause contact dermatitis. So in one study, they used parthenolide depleted feverfew, which removed the skin sensitivity, and it actually still had anti-inflammatory effects, which leads some of the researchers to believe that the anti-inflammatory effects may also be due to flavonoids. Parthenolide seemed to reduce the NF-alpha activity of the inflammation pathway, while the flavonoids tend to reduce the swelling and other related symptoms of inflammation. Next on the list is bergamot, which is a fruit that is very popular in Italy. The essential oil of bergamot is typically used for fragrance in lotions, perfumes, and other cosmetic uses. However, bergamot juice was used to reduce rat paw edema in one study and actually reduced it by 95%. In another study, rats that were given bergamot juice were shown to reduce the effects and even prevent inflammatory bowel disease whenever it was purposely induced in the rats. There are a few clinical studies showing the inflammatory effects or the anti-inflammatory effects of bergamot, but it is still safe to eat. There's no problem with the FDA, and I personally think it's delicious. Next on the list is turmeric, which is something that I use personally. I think it's delicious in golden milk tea, and I also love curry, so naturally I'm a big fan of turmeric. However, turmeric is not the main anti-inflammatory ingredient. Turmeric contains 2 to 5% curcumin, which is the therapeutic ingredient that causes the anti-inflammatory effects. As you can see in the picture, turmeric is very similar to ginger. They are closely related. I was surprised to see that there is an osteoarthritis medicine used that is based in curcumin used to treat the inflammation and swelling of osteoarthritis. In that study, it was shown to be effective in relieving joint pain, swelling, and quality of life in the patients. Flexifidyl was actually shown to be more effective than most NSAIDs, and while turmeric is a really great agent for inflammation, there are some adverse effects that a lot of people need to watch out for. For instance, it does cause contact dermatitis in some people who may be allergic to turmeric. It also was shown to decrease fertility rates in male rats, and other people experience some gastrointestinal problems and nausea. Next is capsaicin, which is typically found in hot peppers. Most studies focus on the hot cayenne pepper. The large thing about capsaicin is that it does improve blood circulation, which is important because the improved circulation may help break up deposits that cause stiff joints. It does alleviate inflammation, but this is a dose-dependent reaction, meaning the more that you take, the more likely you will be to experience anti-inflammatory effects. Anybody that's eaten a hot pepper knows that it is a local anesthetic because it will make your entire mouth go numb, but only after it burns it. However, it does work in places other than the mouth. If you were to rub hot pepper on a sore spot, it will lead to an anesthesia effect. In one study, it was shown to be comparable to NSAIDs and reduced rat paw edema. There are not very many studies with capsaicin and human anti-inflammatory effects, but all of the rat studies show that it is comparable to NSAIDs. So it's important that you take care with herbal remedies because many of them uh, interact with other pharmacological medications. As also, inflammation always has an underlying cause, so you need to always treat the underlying cause before you treat the inflammation. Inflammation is typically a symptom and not a cause of itself. As such, you should always discuss with your doctor if you have any other underlying conditions, especially if you have conditions related to the digestive system, kidney, or liver problems, because many of these remedies could affect kidney and liver functions. These are my references, and that's what I have today for how to treat herbalism or how to treat inflammation with herbalism. If there are any questions, please let me know.